I have a dream that one day this nation will rise up and live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal.
Being a part of MEDX's family saved me and changed me in a lot of ways. I did not know really the path and direction that I wanted to go in. I didn't find my purpose. I didn't have rooted passion in exactly what I wanted to do. And being a part of MEDX and the culture of MEDX gave me that purpose and reignited my passion.
So in 2008, Dr. Brenda Timms brought forth 40 professionals and asked the question, what does the workforce look like in the year 2025? And when we did our homework, we found that it didn't look well. South Carolina was ranked 43rd in the nation in terms of a number of health matrix. We were expecting shortages of physicians and nurses. And we knew that as a system, we would not have the means to recruit the workforce. So we thought the best way we can affect that challenge was to create our own. So beginning with 12 students in 2010, we began the birth of the MEDX Academy, a health career pipeline program, which has grown because this past summer we hosted nearly 200 students.
MEDX offered a community for me. It offered to have friends that were also going through the same thing I was. Because being a first-generation college student, I didn't have any experiences. I didn't know what to expect. And so having friends that had family members go through it was absolutely amazing. Having that guidance from Mr. Squire and having some, test prep and shadowing experiences so I could figure out what I wanted to do in medicine.
We think of MEDX as a healthcare workforce development program, and it absolutely is. But I think even more so in the core root of MEDX is we're aiming to help people become themselves. We're aiming to build leaders. We're aiming to ensure that when you walk in the door and then out the door of MEDX, that you feel more passionate about what you're doing and who you are than when you walked in.
It was my experience that I had the opportunity to participate in research and foster my love for the clinical research and bedside research, as well as shadowing experiences with different physicians, as well as therapies, as well as test prep and building that community. The community is my favorite part.
MEDX wouldn't be a success if it weren't for the community, the partnerships with academics, the donors, and all those parents and sponsors out there who aided us. From the time physicians came on board to all the clinicians who give their time and service to educate our folks, we would not be who we are if we weren't a community program. So although I may be the recipient of the acknowledgement today, I'm actually representing all those people who are behind us, because MEDX is truly a community program birthed by Prisma Health and a statewide initiative that has shown how we can be an effective player in helping the careers of future students who are wanting to become future professionals in the world of tomorrow.
MEDX Academy is helping to advance diversity and inclusion. I think the biggest starting point of advancing diversity and inclusion is with our recruitment process. And through our recruitment process, we're taking into account a lot of different dimensions surrounding diversity and inclusion, but really we hone in on students' personal journeys. And what have they experienced up to this point? Getting to hear their story and hear their journey through our recruitment process and our interview process is enlightening and eye-opening. And then for those students who are a part of MEDX, we're able to tailor their what they need and our mentorship to their individual needs.
For MEDX Academy to receive this prestigious award means the world to me. I started back in 2010 as a wee child, and to see this program get the recognition that it deserves and all of the changes that it has made in this community is really important to me, and I am very proud to be a part of the MEDX Academy.